Port Moresby General Hospital and the Tauranga Aquatic Centre currently holds 169 confirmed cases as of today. 3 new deaths recorded in the last 24 hours.
At the moment, the numbers have actually increased, the number of COVID-19 cases. So they have increased from last week less than 100 to now more than 100. So at the moment, as I'm speaking, in our wards within the hospital, we have about 143 COVID-19 patients in our wards. That's almost in all sections. Like in our isolation ward here, we have about 20 positive cases. Then up in our wards and respective disciplines as well, at least we have holding base where we keep mild, moderate COVID-19 patients in respective sections.
The positivity rate or infection rate is currently at 70%, according to POMGen COVID Committee. This means out of the 44 tests conducted in the last 24 hours, 32 have returned positive. Dr. Randy Moke says the surge is not going to end soon with the current trend.
So you see that the numbers is continuing to increase, and hopefully this will end soon. But we don't expect, the way things are, we don't expect that to end any near soon.
Meantime, Dr. Moke highlighted that oxygen demand has increased drastically.
For COVID patients, at least 15 of such cylinders in any one day. So that's for just one patient. It is seen that at least for a week, you would expect more than 600 of such cylinders in a week.
Adding the National Department of Health is supporting in ensuring adequate oxygen supply. He pointed out that the hospital is still in need of support.
So far, our team are able to manage the current, but we need more support. We're still pushing for space. We need more space, and we need more support in terms of provision of oxygen. We will need more support in terms of ensuring we have enough staff for both medical officers as well as nursing staff as well.
While 3 deaths have been recorded in the last 24 hours, the recovery rate is exceptional.
Recovery has been good. Those that mild, severe, moderate tend to improve a lot. They become mild and asymptomatic, and most of them have been really discharged. Some of them stay a bit longer because they also have other comorbidities as well. But otherwise, as much as possible, when they become mild, we either transfer to Tauranga Aquatic Centre or get them going home, discharged home, on treatment, yeah.
EMTV asked on what kind of treatment is being administered to COVID-19 patients whilst in the holding bay or isolation ward. Doctor said the treatment currently given is the standard for COVID-19 patients.
At the moment, the mainstay of treatment is oxygen. We need to ensure that oxygen is adequate and supplied to the COVID-19 patients. And then other infections or superimposed infections like giving them antibiotics, ensuring covering them for that. And also steroids or dexamethasone, because there's a lot of inflammatory processes going on in their body, in their lungs. And so to reduce that, to reduce the inflammatory processes that's triggered off by the virus itself, we need to ensure they're covered with steroids. So we give them dexamethasone and then vitamins and supportive treatment as well.
Dr. Moke says it's the unvaccinated that are flooding the COVID wards and urges the public to be vaccinated.
Most of the patients that are admitted are those patients that have not been vaccinated. And so I think it's really, really important that those who are mainly at risk of developing the severe form of COVID-19, it's really good and better for them to be vaccinated, like those that have diabetes, those that have hypertension, and those who are pregnant as well need to be vaccinated.